Hello, everyone. My name is Sherry Morrison, and I am with Success by Design Wellness. And I am here to talk to you about a new revolutionary device that we just got in our clinic called Emface. So, just before I get started, I just want to give you a background of myself and my business partner, Tammy Horner. That's me on the right, and Dr. Horner is on the left. My background as an RN has been in the wellness and aesthetic industry for the last 15 years. I have been really focused on helping patients get the right nutritional program in place, as well as feel their best and look their best. And Dr. Horner, my partner, she actually is an anti-aging functional medicine doctor and focuses a lot on bioidentical hormone management with the BioT pellets. We offer a wide variety of different services in our practice. This is our team. We have nurse practitioners, physicians, and support staff that all welcome you and are so happy to have you part of our clinic. In addition to weight loss and hormones, we also do a lot of different body sculpting treatments with Emsculpt Neo, which we can talk about in another webinar. And we also have a device called Mtone that helps with cellulite, and a device called Mcella that helps with urinary incontinence and also vaginal rejuvenation. So with that, I want to talk to you a little bit about how your face ages. We all see fine lines and wrinkles on our face starting at a pretty young age. And what we do usually look at is like, what can we do with our skin? And that's one of the things that we've specialized in over the years at Success by Design, is helping patients rejuvenate their skin using different treatments like microneedling, as well as Botox, fillers, Sculptra, and BI peels, and just really good skincare line that we cover. But the facial lines that we're seeing are not just coming from the surface of our face. In fact, we're actually aging inside the structure of our face, including like our skin, our fat pads, our muscles, and our bones. And in fact, we have 5 different layers of our skin, and what we see is the surface, but below that we've got some fat layers and muscle and bone, and all of these layers are aging at the same time. So when you're seeing some aging on your skin, you have to also realize that your structure, your muscle, your bone, and your fat is also changing. And when one part of your face is aging, all of them are aging because they're all intertwined. What we do see is changes on the surface of our skin and our texture. And a lot of that is because we do see collagen and elastin, which we have a lot of, as you can see in this side in your younger skin. But as you get older, those collagen and elastin fibers start breaking apart, and the skin starts to sag, and the texture starts to get rough, and our pores look a little bit more larger, and we start to see some hyperpigmentation coming to the surface. This really does start at a young age. In fact, we're losing collagen 5% every year after the age of 25. So when we're young, we naturally do see lines when we make expressions, like when we raise our eyebrows, we see lines on our forehead, or when we smile, we see our crow's feet, and we see smile lines as well in our nasolabial folds. And just think about your skin as like a piece of paper. And every time that you fold that piece of paper, the line just keeps getting thicker and more delineated. Well, that's what's happening with your skin over time as well, because we're losing our collagen and elastin, and we're keep making these expressions. And those dynamic lines that we see when we're young change to static lines. In other words, they're there regardless if you're making an expression or not. They're more permanent. And on top of that, we're losing fat in our face. So when we're young, we have a lot of, grape-like fat pads in our face, and they're high up, and you get a lot of volume with that. But as we start aging, our fat pads actually turn from grapes to raisins, and we actually start losing volume. And on top of that, our muscles start getting weak in our face as well. So those fat pads start actually dropping, and that's where we're seeing more results of wrinkles and sagging and drooping skin. And so each decade, we're losing more and more of our muscular strength, and our muscular density, and we're also losing our fat pads, and our fat pads are starting to change. And by the time you're, age 55, that's usually when you can see, all the changes that are going on in your face, and you're starting to look at not just, you're getting a receding hairline, and you have the forehead lines, and then a lot of people get those drooping eyebrows and they have to go for surgery because it's affecting the way that they can see out of their eyes. Crow's feet become more permanent and get a lot of crepiness under the eyes and hollowing over the cheek areas where you look more hollow, and more sagging at the bottom of your face, and more jowls and wrinkling at the bottom of the face. And I'm not sure if you've ever heard of the triangle of youth, but when you're young, you have an upside down triangle. All your volume is in your face is on the top part of your face. You definitely have a lot more cheekbones and full cheeks and a defined jawline. And as you age, as everything starts getting weak, you actually see more volume or more sagginess down at the bottom of your face. So they call that the triangle of youth that's inverted. But a lot of this has to do with the musculature of your face. And to date, there has not been a way to treat this. Emface is the first and only device that treats the facial muscles, especially your lifting muscles, which is your frontalis muscle, your zygomaticus major or minor, and your orissorus. Your frontalis muscle is one of the larger muscles in your face, and it's responsible for lifting your eyebrows. And so when that muscle gets weak and it starts to lose its density, then you start seeing those more static forehead lines, or you start getting the drooping eyebrows and the hooded eyes. And also your glabella, which a lot of people call the 11s, gets a lot more defined because you're losing that musculature and volume in that area. And then what's holding everything together, which Emface actually treats as well, is your connective tissue and your elastin and your collagen, because not only is it working out the muscles in your face, which you're going to see a live demonstration in a moment, but it's also working on the collagen and the elastin using RF energy. And what you get when you simultaneously are treating the structure and the skin at the same time is you get 30% increase in muscle tone, a 37% reduction in visible wrinkles, and a 23% increase in lifting. So it's like a non-surgical facelift without having to do filler or too much Botox or Dysport. Not to say that those aren't going to be important, and down the road there will be a place for that. But when you are dealing with building the structure of your face, you're going to need a lot less filler, a lot less Sculptra, a lot less Botox and Dysport. So this procedure, Emface, is 2-in-1. It's synchronized radio frequency thermal energy and something called HIFES. So it's adding reinforcement of the facial muscle structure. It's affecting the facial fascias, which is what actually supports your facial soft tissues, and it improves the skin texture. So I'm going to show you a video now of how this device actually works. So here's a video of me starting to get my Emface treatment. I am about to get an Emface treatment. This device is revolutionary. It does both skin tightening and toning, and it also builds the muscle in your face. So you're working on the foundation and the structure of your face, and it's only working on the levitating muscles, and you're gonna get this nice snatched look. You're gonna get an even skin tone. So stay tuned, we're gonna start the treatment. So this is the device. This is what it looks like when we have a patient on it. We are able to actually individualize each treatment for our patients based on how they're tolerating it, but it is an incredibly easy to tolerate treatment. The heat feels actually good. It's very comfortable, and the contractions feel like you're having a facial massage. At first it feels a little weird, but you get used to it and it ends up being really relaxing. So watch this next video. Go. Okay, so the applicators are placed on my face. They are strategically put over your lifting muscles because that's what we want to work out and strengthen and get more volume in our faces. So it works on the frontalis muscle. It's going to be pulling, like you'll see when I start the treatment, my eyebrows are actually going to be lifting. And so ultimately this muscle is going to get a lot stronger, and I'm going to have higher eyebrows and that lift over right on the lids, which a lot of people need as they get older. Also, it's working on your zygomatic muscles and your psoas muscles. These are your lifting muscles. So when these muscles are strengthened and there's more volume, you're going to actually be getting like a facelift. And you're going to see these muscles moving up as well. It's a crazy experience when you have it, but it actually feels good, because there's another energy called radio frequency, thermal energy, that's heating up the collagen. So it kind of feels like a warm stone massage. It's very comfortable. So one more video just to kind of actually show the device working. I mean, watch my cheek muscles and my forehead muscles moving. And that was only a 10-second video, but you can come in and actually see the treatment live. So we have some great before and after pictures. They just recently launched this device on September 17th, and this device has been studied more than any of the BTL other devices, but they wanted to get this technology exactly right, targeting the right muscles to get the right results. So we have had other physicians in the nation that have had this device a little earlier before it came to market. So they have some more sophisticated before and after pictures because they've had this device and they've had like time for patients to see their results. Because you do need to do the 4 treatments, and then we have you come back 3 months later, because collagen and elastin need time to rebuild itself. It doesn't matter what type of procedure that you do to rebuild collagen. You can do peels, you could do microneedling, lasers, Fraxel. All of those results are not seen until 3 months after the treatment is completed. So a lot of these before and after pictures that I'm going to go over with you are either right after 4 treatments, or they've waited a month or 2 months or 3 months after this treatment. So you can see in this patient here that she's already had 4 treatments, and you can see just in the cheek area how much more volume that she's built up. Here's something that's just a little further away, so it can kind of give you a better idea of just the kind of volume and the snatched look that you'll be getting. And notice the nasolabial folds, how much less that there is. So if you did need filler, at this point, you're not going to need as much filler. This is a patient that obviously looks like they have a little bit of older skin, but even with older skin, you can see just after doing the 4th treatment how much more lifted her jowl area is and how much more volume she has in her cheek area. And like I said, these full results won't be seen for a couple more months after this last picture was taken. Again, this patient actually had some time. This had 3 months after their 4th treatment to really get the results. But if you look at the smile line where that's moved up and the nasolabial fold has also like so much less and so much more volume in the cheek area. And here's this is what I was talking about when I said a static line, that he's not making an expression, but there's a line there. So look at the difference in his lines and how they've actually gone away in this patient. Men always do better in everything, don't they? So here's another patient that had a nice lifting. This was 3 months after her 4th treatment. Now, after you're done your initial series of Emface, I mean, if you're getting results, you can go ahead and keep going and doing more treatments. But, think about how much money you'll be saving if you were to do any fillers or Botox or anything like that, because you really are working on the foundation and the structure of your face, which is giving you this volume. And so therefore, you're not going to need as much product, if at all, depending on where you're at. You can see her static lines have significantly decreased. And this is right after 4 treatments. This isn't even after the collagen had a chance to rebuild. This patient got a really nice eyelid lift. I mean, I'm sure she probably was looking at surgery at some point in the future, but after doing the Emface, look how much more lifted her eyebrows are now. And again, the static lines that we were talking about, how much better that they get after you give that volume back into your face. This is actually Dr. Horner, my business partner. So her and I have had the opportunity to just finish 4 treatments. In fact, we just did it last week. So already you can see a difference in how her smile line is a lot shorter and less significant. And you can see that her muscles are lifting, the jowls look better, and she has definitely more volume. Here's another view of her. And we were lucky enough to partner with another spa in a different part of the country, and they have had just finished their treatments. And this patient is just after 4 treatments. It doesn't matter what age you are, you still get results. I mean, younger people that want to maintain the structure of their skin and want to prevent the volume loss can start, or older people. And I'll show you my before and after pictures because I'm 58 years old now. And I'll show you some pictures of me before I even started any of these type of treatments. But here's another patient. Look at her nasolabial folds and how much better her skin tone looks. And this is just after 4 treatments as well. And here's a side view. Definitely more lifting, and that nasolabial fold right by her nose is so much less now. Okay, so here's me. The first picture was taken to the left in December of 21. And I was really upset about the creepiness and the sagginess that I was having in my jowls. And so I did Sculptra, and Sculptra is another product that we offer here. So the second picture is after injecting Sculptra, and 3 months after that, because with Sculptra, it's an injectable, it's not a filler, but it's polylactic acid and it stimulates collagen by like 70%. And you get like a rapid collagen response. It's a natural way to fill your face with volume. But again, it's not working on the muscle and the structure, but it is working on the collagen and building that up. And you can see this was actually taken today, this last picture, after I was doing Emface. So here's a front view. You can see I have lost volume. My nasolabial folds are more pronounced. And then the middle picture is after doing Sculptra, like 3 months, which I think I got a great result from that. And it really did change my texture and I did get a lot of volume. But this picture that's to the far right is after doing Emface. And just look at how much more lifted and that my cheeks are after doing Emface. And my skin tone even looks better. And this was just after the 4th treatment, so I'm expecting better results. So we have some more before and after pictures of men and women, just focusing on different parts of the face. Another picture that was measuring like the space between the eyebrow and the top of the eyelid. And look how much more lifting. This is someone that was not happy with their neck or their jowls. And by strengthening those zygomatic muscles that make you smile and pulling up those fat pads, it affects the neck and it also affects the jowls. So you're getting more of a lift in the neck and the jowl area as well as in the cheeks. So like I mentioned, this device has been studied 9 clinical trials. We have had 93% patient satisfaction and 90% of patients that do Botox and Dysport say that they like the results because they seem to be a much more natural appearance. But like I said, you could do this in combination with any of the injectables and really get a more youthful, natural look. So these are just some testimonials. And it's been all over the media. I'm not exactly sure if you've seen like Jessica Simpson or some of the other stars. Alicia Silverstone, I think, was also using Emface. But you'll see it on Instagram and also on TV and streaming because it is the greatest device for a non-surgical facelift where you're working on the structure and then you're also working on the skin tone and tightness. And for listening to this webinar, we are giving everyone $1,000 off our packages. We are staying very competitive. We are the only clinic in the St. Pete, Pinellas Park area that has this device. We were the first to come to market. And so we're really excited about getting our, more of our own before and after pictures. And I'm happy to answer any questions that you might have.